Beautiful. So welcome everyone. This is Pelvic Care for Acupuncturists Introductory Workshop. This is a 1-hour NCCOM approved and California approved PDA. We're almost there with Florida, so hopefully that comes through very, very soon. I'm Dr. Krystal Couture. I am a PT and I'm also a licensed acupuncturist. I live in New Hampshire and have a practice here in Portsmouth, right on the seacoast. And the reason that I want to bring pelvic care to acupuncturists is because we have a very unique opportunity to help these clients in a way that no one else can. We have the strength of bringing together the concepts of traditional Chinese medicine, what we do with acupuncture, accessing those TCM patterns, also bringing in those concepts of spirit of the points, which works with the emotional components that are very highly and heavily related to the pelvic floor, and also working with muscle-specific ashi points or dry needling of both the pelvic floor and the concomitant structures. So I'm going to just share my slideshow here. And beautiful. So here we are. This is our Pelvic Care for Acupuncturists Introductory course. I'm going to have someone pop in the slides for you so that you have access to those. Okay. And here's my bio. And let's connect. If you feel like we have a resonance together, I would love to connect with you on Instagram. I'm the Pelvic Acu. Many of you probably found me there, but if you haven't, I'd love to connect. My mission is really to help you bring pelvic care to your practice. I want this to be a game changer for your clients, and I also want it to be a game changer for your practice. And I love supporting other acupuncturists. Like, that's what makes me so excited, is seeing the ripple effect of what we can do as practitioners when we share knowledge and expand together. Okay. All right, so pop your number into the comments. Why are you here? Do you want to bring pelvic care into your acupuncture practice? Do you want to heal your own pelvis? Or are you looking for a combination of both or something else? Just pop your feelings into the comments there. Beautiful. Okay. I'm just gonna grab those slides, pop them in for you. There you go. There's the slides. Kelsey, both. Tangela, both. Alexa, both. Everybody, both, right? Patty Couture, both. I love that. So yeah, bringing in the components of healing your own body to heal your clients. And that's the nature of ancient medicine, right? Before medicine had all this science and all this research, what did people do? They started going into their garden and taking the herbs that they wanted to see what they did, and they wanted to see what they healed. And there was an intuitive medicine to that. So healing your own pelvis is definitely going to help you to bring pelvic care into your practice. Love that. Okay, so let me tell you about the structure of how I work. In a 1-hour course, we don't have an awesome opportunity to go through everything you're going to need to say, hey, I'm a pelvic care specialist for acupuncture, right? So I've developed a system that, since I've been in practice since 2006, I've taken all those years to develop a system that works for clients. So my advanced certificate program includes my online courses, which are anatomy and physiology of the pelvis, pelvic pathology, which includes both a TCM and a Western perspective, spirit of the points of the pelvis. I was trained as a 5 elements acupuncturist. Spirit of the points on its own is a very useful modality if that's all you do. But if you work with reproductive health, utilizing spirit of the points with what you're already doing is like the icing on the cake. It's where the magic lives. I have a workshop called Complementary Techniques. Complementary Techniques, we talk about all the things that are lifestyle factors that your clients can change, modify, or do at home to help them build pelvic awareness, make your treatments last longer, and then improve the patency of the pelvic floor for the long duration, because we actually want this to be sustainable, right? We don't want this client to come back 6 months later and say, hey, I'm leaking again, right? We want this to be something that they're able to have the tools in their toolkit to work with on their own. And maybe they'll need intervention here and there, and they'll probably come and see you for other things. But we want them to be able to be in a place where their quality of life is at the best possible state. And having to struggle with pelvic floor dysfunction for your entire life is not an optimal state of quality of life, right? We also talk about Chinese nutrition for the pelvis. This is another big one that clients can take into their own hands. Then we go into pelvic care treatment techniques and protocols, which is sort of the meat of what we do, wrapping those three components of spirit, TCM, and dry needling, ashi point needling, sinew needling, all that kind of physical needling in together. And then, of course, we talk about ethics and safety because they're particularly important for the pelvic floor, especially when we're talking about, perhaps dry needling or muscle-specific ashi needling, but also because there is a safety and ethical component with the emotions of working with the pelvis. So I'm really passionate about that as well. And of course, we need those NCCIOM credits, right? All right, my advanced certificate also includes a practical and a live component. And then there's some bonuses that we put together, which are email templates and social media templates for you to work with, to bring your branding to, so you can bring pelvic care to your audience without having to do so much. If you stay with me till the end of the workshop today, or if you get the recording in the next 24 hours, I have like the deepest discount code that I ever offer on my courses that will be available to you. So stay with us, or you have the slides, so you can actually look ahead and grab those, but those are only good for 24 hours. So we also have really exciting news. October, it's actually, oh, I'm sorry, these dates are wrong. No, they're right. October 12th and 13th, I'm going to be in Portsmouth, New Hampshire, which is where I live, doing a live practical. It's about 1 hour from Boston. It's really amazing. And I'll be doing a live practical on November 9th and 10th in Hallandale Beach, Florida, which is just between Fort Lauderdale and Miami. So it's convenient as far as airports and that kind of thing go. So I would love to have you in my lives if that resonates with you. Okay, so where do you want to see pelvic care? If you're not going to travel to Boston or you're not going to travel to Florida, drop your dream city in the comments because I'm currently planning my 2025 schedule now. So let me know what you think. Let's talk about, while you're popping your dream city into the comments, let's talk about the table of contents today. So what we're going to cover is the basic anatomy of the pelvic floor. We're also going to talk about the function of the pelvic floor. We'll talk about some common pathologies, common TCM patterns. We'll talk about the need for support when it comes to pelvic care, which includes quality of life, as well as some acupuncture pelvic health research, which is pretty amazing. And then finally, we're going to talk about treatment techniques, which are your tools in the toolkit. We're going to talk about the pelvic breath, and we're going to talk about some of those lifestyle changes that you can start recommending to your clients right away. How awesome is that? Okay, Chicago, Kelsey, I got it. All right, let's see what we can do about Chicago in 2025. So first off, what is the pelvic floor? Well, everyone has a pelvic floor. Every gender has a pelvic floor. The pelvic floor is a group of muscles, tendons, and ligaments that connect the bones of the pelvis, creating a hammock or basket-like support, which holds the bladder, the uterus or the womb, and the bowels. So pelvic floor is really, really important. I'm going to stop my share now so that you guys can see me in full screen. Here we go. And we're going to do our anatomy lesson. You've got some slides, but also I want you to have the viewpoint of the model here, okay? So this is our pelvis. So let's get oriented first. This is the front of the pelvis as if the client is facing you, okay? So right here, we've got this cartilaginous structure. That is the pubic symphysis, okay? Coming off of that, of course, we've got our pubic bones, right? We've got the ischial tuberosities, So those are the hip bones, so to speak, that we can feel in our sides. We've got the ASISs here, so the anterior superior iliac spines, which are important for palpation of the pelvis. We go into a lot more detail in the anatomy class, but it's important to know those for palpation when you're starting to work with the pelvis. As we go down, we'll put our client supine, right? And then we've got the sit bones here, also known as the ischial tuberosities. Okay, we'll turn it around. So sitting back to you now. So we've got our iliac crests. Our iliac crests come in, right? And these are going to be our sacroiliac joints or SI joints. This is our sacral bone. And in this model, I really love it because you can actually see the sacral foramen or those holes really, really well. And then we've got the coccyx. Of course, the other thing, since we talked about the ASIS, we've also got the PSIS, which is that bony prominence that you can see on a lot of people and definitely feel with your hands if you've got them prone on your table or if they're standing up in front of you. And that PSIS, posterior superior iliac spine, is also going to be really, really important for palpation of what's happening with the bony structures, but also what's happening with those soft tissue structures, the muscles, the tendons, and the ligaments within the pelvis. Today, we're going to highlight just one ligament, and I think it's important, which is why I always bring it up in every class. So right here, what you can see coming from the sacrum to that ischial tuberosity is our sacrotuberous ligament. This is a round ligament. I also always palpate this ligament side to side to see what's happening right and left, right? So that's the sacrotuberous ligament. Since we're starting with going into the musculature, let's go ahead and just do a quick review here. So we've got all of the superficial muscles of the gluteals kind of stripped off here. And we've just got some of the deep rotators of the hip left. Of course, we've got the piriformis here. You can see that coming off the inside of the sacrum. And then this little tail of a muscle here, that's actually the obturator internus. So this is our obturator foramen that we can see here. So that is actually the belly of the obturator internus muscle. Internus because it's inside. It plays an important role in obviously rotation of the hip, but also in that support of that basket-like structure. If I hold my pelvis up like this, you can kind of see that it does create that bowl or basket or hammock, right? And if those, you can also see that if those structures are not strong and supple, then there's going to be a dropping down, right? And if they're too tight, there's not going to be that basket-like structure. So I want to be really conscious of what that feels like. And that's going to come back to us multiple times here in the workshop today. Okay, one of my favorite muscles to talk about when we talk about the pelvic floor is actually the coccygeus muscle. The coccygeus muscle, you can see, comes right off of the coccyx bone. The coccygeus muscle is one of the bigger muscles of the pelvic floor. It's more superficial than the levator ani, and it is very, very useful. It is like the magic muscle for helping someone to release sacral or coccyx pain. It's just amazing. I love working with that muscle. What I would recommend for you today, since you're only getting a portion of what we do with pelvic care, is I would start palpating. And you can start to feel on your own body where these muscles are, and then start to feel, maybe on friends or family, and then go into your practice and start palpating. Seeing what these muscles are up to, getting that physical feedback to see what's happening here. Your client will also provide feedback. If we've got tenderness and tightness or trigger points on one side and not on the other, and then we also notice that there's like an imbalance between the locations of the PSISs, and let's say we've also got SI joint pain, well, then we're starting to get some really good information about the pattern that this client is going through. They've got some type of asymmetrical pattern, right? We don't know what it is yet, but they've got some type of asymmetrical pattern. And we want to start being aware of those details because that's what's going to make us a really good pelvic care therapist. Okay, so let's go into the muscles of the pelvic floor itself. And let's get some awareness to where we are in the body. So now our client is lying down on the table. Let's say supine because we've got the pubic bone facing up, right? Okay, so this is a female model. So we're going to have the vaginal opening, and then we're going to have the anus here. This, of course, is going to be the perineum. The perineum is the tissue between the vaginal opening and the anus. Then we've got, of course, the external anal sphincter here, which is going to be a muscle that controls the opening and closing of the rectum. Coming right off of the perineum this muscle, makes a lot of sense, the name. It's called the transverse perineal muscle. It is a very superficial muscle. Following this triangle here, up along the pubic bone, we've got the ischiocavernosus muscle. And then finally, for our superficial anatomy, very superficial muscle here, this is called the bulbospongiosus muscle. Okay, so that's our superficial anatomy. Superficial, transverse perineal, ischiocavernosus, bulbospongiosus. Our deep anatomy is going to include the levator ani. The levator ani has 3 components. Those 3 components are going to have 3 lanes. I say 3 lanes because it's important to dial in what we're palpating when we're working with clients, and also to really understand what's happening in the pelvis. So 3 lanes, because if the client was on their side, which is how I generally palpate, and also how I needle, right? If I match my fingers up, I have 3 muscle lanes right there. So that's just the terminology I use. Something else might work great for you, but that's my trick. Okay, so our most medial lane is going to be the puborectalis muscle. You can see that's obviously closest to the anus, so puborectalis sort of makes sense. Next up here, we've got the pubococcygeal muscle, and then we've got the iliococcygeal muscle. So those are our 3 lanes of the levator ani, and also the deep layers of the pelvic floor. All right, let's just take a peek inside here, what we've got. So now we can really see that energy of the bowl or the basket, right? That supportive structure. So of course here, we're gonna have the opening to the bladder, then we're gonna have the opening to the vagina, and then we'll have the opening to the anus, right? So we can see all of those structures. Okay. So that is our very brief and basic anatomy lesson of the pelvis. Next, let's talk about the function of the pelvis. Okay. So you've got more slides to help just kind of reinforce things here. All right, and next we're going to get into that pelvic floor function. So the pelvic floor functions in, let's say, 3 primary ways. First off is going to be organ support. Okay. That hammock-like support structure is designed to keep all of those lower abdominal organs in optimal alignment. The pelvic floor is going to be activated in conjunction with the abdominal muscles and the muscles of the back, especially when it comes to activities like lifting, bending, carrying, jumping, when your legs are kind of like in a lunge position, so stretching on that angle. What happens during these activities is that there's an increase of the intra-abdominal pressure. The pelvic floor is particularly important in keeping those lower abdominal organs from being pushed downward and prolapsing. So if that pressure is increased and the pelvic floor cannot contain that pressure, then what we've got is we have the potential for prolapsing. We also have the potential for leakage, but we'll talk about that more in a moment. So the key is we can have, and here's the like nugget of gold for you here, is that the pelvic floor muscles can be tight and weak. So we can palpate the pelvic floor and find that there are trigger points, there is tightness, there is discomfort there on palpation, and there's also a concomitant weakness. That is a very common way to look at the pelvic floor as we're practitioners. We see that very, very often. So I just want you to remember that little nugget. Okay, second function for the pelvic floor is in sex and reproduction. So first off, in women, during sexual activity, the pelvic floor muscles help to increase blood flow to the genitals, promote arousal, lubrication, ease of penetration, and of course, orgasm. In men, the pelvic floor muscles help to manage the blood flow to the genitals by compressing and releasing those penile veins. When the veins are compressed, that's going to trap blood within the penis to create an erection. Okay, so the pelvic floor function has a lot to do with how one achieves sexual arousal. So really important function there as well. Finally, urinary and bowel function. The pelvic floor is going to house those openings from the urethra, the bladder, the anus, right? The pelvic floor helps to close those openings to prevent leakage and relax them for emptying. The pelvic floor supports the continence of the bladder and the bowel in both men and women, really in all genders, right? We're going to talk about building awareness at the end of the workshop to the pelvic floor. And this is my big ticket item for you. It's called the pelvic breath. And it's how we start to get our clients to build awareness to their own pelvic floor. Once our clients are able to have awareness and understand what's happening within their body, we can really start to promote change. Next slide. There we go. So let's talk about some of the common pathologies from the Western perspective. So when talking about all gender conditions, urinary disorders are going to include incontinence, which is going to be the loss of bladder control and thus leakage, frequency, which is utilizing the bathroom to urinate more than once every 4 hours, retention or difficult urination, which is that the bladder is holding in some form of urine, or it's difficult to release that urine. Dysuria, which of course is pain with urination, hematuria, which is blood in the urine, recurring bladder infections or UTIs, interstitial cystitis, and neurological conditions. I just want to say really quickly, while we're talking about urinary conditions and UTIs are on our list here, that doing the work of working with the pelvic floor without looking at the pelvic ecology is doing only half of our job, right? Because UTIs are directly linked with spontaneous instance of incontinence. So we need to be able to have these conversations with clients regarding the ecology and infections, as well as working with the pelvic floor. And that's something I think acupuncturists do really, really well. I love that about our medicine because it includes so many components. So we don't want to do half our job. We want to include that ecology, and we want to include the musculature as well. Okay, so let's talk about rectal disorders. Here we've got incontinence, we've got pain, we've got constipation or diarrhea, and hemorrhoids. If we look at the pelvic pathologies from the perspective of those for female or assigned female at birth versus those assigned male at birth, okay? So in those assigned female at birth, AFAB, we've got pelvic pain and dysfunction disorders, which would include endometriosis, fibroids, vulvodynia, yeast infections, painful intercourse, and pudendal neuralgia. We also have the instance for pelvic prolapse, which is really most common in those assigned female at birth, which are going to occur in the bladder, the rectum, and the uterus. For males, the most common in pelvic pain category are going to be unexplained chronic pelvic pain syndrome, prostatitis, and pudendal neuralgia. And some other pelvic dysfunctions that we'll see commonly are going to be erectile dysfunction and Peyronie's disease. Okay, so let's talk about the TCM patterns that we see. Now, of course, you know this. Any TCM pattern needs to be diagnosed by the pulse and the tongue and then the symptomology, right? And we don't have the opportunity to go into massive detail about this today. And we don't always have that detail in practice either. So what I've done is I've kind of created groupings of disorders that are most commonly associated with the different types of pathologies. And here's that list for you. So with urinary patterns, what we often see is kidney qi deficiency, damp heat, kidney yang deficiency, kidney yin deficiency, spleen qi deficiency, and liver qi stagnation. With the bowel, we'll commonly see large intestine cold or large intestine damp heat, liver fire insulting the lung, liver invading the spleen, spleen qi deficiency, or spleen qi sinking. With those assigned female at birth, qi stagnation, damp heat, spleen qi sinking, liver qi deficiency with stagnation, kidney yang deficiency, kidney yin deficiency, and of course, spleen qi deficiency. In those assigned male at birth, liver qi deficiency with stagnation, kidney qi deficiency, kidney yang deficiency, kidney yin deficiency, damp heat, and just general qi stagnation. Okay, so we're going to take and just look at some of the most common pathologies that I see in my practice related to the pelvic floor. So we're going to start off with spleen qi deficiency, kidney yang deficiency, damp heat, and then liver qi deficiency with stagnation. So here we are, spleen qi deficiency. Okay, so the urinary conditions that I see most commonly with spleen qi deficiency are going to be frequency, retention, UTI, and interstitial cystitis. With the bowel, hemorrhoids, of course. Those assigned female at birth, yeast infections. So as we know, spleen qi deficiency is primarily caused by this excessive worry or mental activity. You know this constitution. It's one where someone comes in and they're able to tell you all of their worries. Their mind is running, running, running. Their diet can be irregular. They can have prolonged impact, prolonged illness, and these also really affect the spleen qi. The energy of the spleen, right? It ascends. So every meridian, right? Either ascends or descends. Stomach descends, that makes the most sense. Spleen ascends. This creates an equilibrium of descent for the turbid waste. When spleen qi is deficient, the clear and the turbid become mixed, and thus neither ascend or descend. This is a huge problem, especially for the pelvic floor. The concomitant conditions here are going to be a poor appetite, abdominal distension, sleepiness after eating, weak limbs, loose stools, and yellowing within the face. The pulse here, as you know, is going to be weak and thready. The tongue is going to be pale and swollen with a thin or thick white coat. The connection to the pelvic floor here is that there is a proprioceptive confusion of ascending and descending qi, which can impact the ascending or contracting and descending, relaxing of the pelvic floor. The Maciosa points are moxa, of course, on spleen 6 and stomach 36, spleen 3, CV12, bladder 20, and bladder 21. Now, spleen qi deficiency, especially in relation to the pelvic floor, very often overlaps with a kidney yang deficiency, and I see this commonly in my practice. So guess what? Kidney yang deficiency. All right, here I see kidney yang deficiency with urinary frequency, urinary retention, and dysuria, pain with urination. Those assigned female at birth, endometriosis, which often is going to be kidney yang deficiency plus blood stagnation when we've got endometriosis. Those assigned male at birth, erectile dysfunction, and Peyronie's disease. Makes sense, right? So kidney yang deficiency fails to support metabolism and transformation of fluids. The weak yang energy is going to yield a poor movement of qi, right? Yang is that big, full, moving energy. And so we've got a yang deficiency, we don't have that. So thus we've got a reduction in qi mobility. Some concomitant conditions here are going to be experiencing cold, backache, a low libido, infertility, dizziness, tinnitus, and then that bright white complexion, right? The pulse with kidney yang deficiency, as you know, is deep and weak. The tongue is going to be pale with a white coat. The connection to the pelvic floor here is that weakness or overactivity in the core and the pelvic floor reduce the kinesthetic awareness of the core and the pelvic floor. So what does that mean? Well, that means that if the qi is not being delivered to the pelvis, right, to that pelvic bowl, it can have this resultant weakness. We can also have an overactivity level, right, like an overcompensation. That overactivity can also cause an imbalance. So that's its own sort of issue, right, is that the core and the pelvic floor aren't working synonymously because the qi is just not being transported well. Now, if we also have a reduction in the transportation of fluids or a poor transportation of fluids, well, that's going to be a problem for the pelvic floor too, because the pelvic floor, in regards to fluids, there's a lot of fluids, right? We have the bladder, which has urine. We have the uterus, which has blood. We have the essence, we have jing within the kidneys, right? We have yin as well within the kidneys. We have yang in the kidneys. So when the fluids are confused and they're not being transported, this is going to reduce one's awareness to the pelvic floor. Now, there's an inherent problem here, which is that we are not, as humans, especially in Western culture, taught about the pelvic floor. So how can we really have awareness to it if we're not taught, one, to be present with our bodies, and two, we're not taught at least a basic understanding of what's happening and how it works down there, right? So some of the points here, of course, bladder 23 and 52, or 52, if Jingong, governing vessel 4, CV4, CV6, kidney 3, and 7. Sorry, I almost went down a rabbit hole. I'm going to try to avoid the rabbit holes for the moment. MOX, of course, is indicated provided there's not some concomitant excess heat condition, which would be rare to see with kidney and yang deficiency, but it is possible. Okay, so now let's switch gears here. Let's talk about damp heat. So damp heat with urinary conditions, we're going to see frequency, retention, dysuria, UTI. With bowel, we're going to see particularly damp heat in the large intestine, incontinence of the bowel, as well as pain. We can also see with those assigned female at birth, particularly damp heat with the liver can produce pelvic pain, fibroids, and yeast infections. And those assigned male at birth, we've got pelvic pain, erectile dysfunction, and Peyronie's disease. Now, we'll start with damp heat in the bladder. Damp heat in the bladder or the local luau channels can really block the transformation of qi within the bladder and thus obstruct the free passage of urine. Internal damp heat can arise from a yin deficiency, of course, qi stagnation, prolonged stagnation of damp. This internal damp, this is important. The internal damp heat is going to present with systemic systems, whereas external damp heat is going to present with more localized symptoms. So what that means, external heat, if we see external heat, someone is going to have heat that is very specific in location. They might say that they have heat just in the lower abdomen, right? If they have a more internal damp heat, those systemic symptoms are going to show up. So they're going to have heat throughout their whole body. And this is actually really important when we start to work with damp heat, is sort of to start to be able to qualify that heat and understand what's happening with that heat so that we can disperse it and release it from the tissues. Concomitant conditions here are going to be classic with damp heat: burning in the urethra, dribbling of urine, turbid urine, deep yellow urine, hematuria, which is blood in the urine, stones in the urine, right? All of those classic heat conditions, abdominal distension, and of course, fever and thirst. The pulse here is going to be slippery and rapid, and particularly wiry in that left rear position. The tongue, of course, is going to be yellow and very likely have a sticky coat to it. The connection to the pelvic floor here is that damp heat can really injure the yin and cause expansion or overstretching of the core and the pelvic floor. Think of bloating as that kind of over expansion, which can really over time lead to weakening of the core and the pelvic floor. It can also lead to, in addition to that weakening, we can also have that like overstretched tightness that I mentioned earlier. Some of our points here: spleen 6 and 9, bladder 22, bladder 28, CV3, bladder 63, bladder 66, and stomach 28. Okay, let's get into liver qi deficiency with stagnation, because this is really important for vulvodynia in those assigned female at birth and prostatitis and ED in those assigned male at birth. Liver qi, of course, we know it's disrupted by what? Emotions: frustration, anger, resentment, emotional turmoil, the repression of emotions, and continuous stress. Because that liver channel passes through the lower jiao, it can impact the bladder qi. So thus it condenses the fluids and hormones into heat or damp. Some of our concomitant conditions here are going to be emotional upset, rib, chest, abdominal distension, a lump in the throat, and of course that classic sighing, premenstrual syndrome, and menstrual irregularity. This liver qi deficiency with stagnation can also manifest into heat. So there can be the feeling of heat and irritability. Here we're going to see that pulse be wiry. We're going to see a normal or dark tongue. And the connection to the pelvic floor really here is that the emotional dysfunction really inhibits the pelvic floor dysfunction. And that really lends itself to the nature of our medicine, right? If we treat a client, and I've done this because I was a PT before I was an acupuncturist, right? I knew how to needle the pelvic floor before I understood the energetics of the pelvic floor. And you can do a really good job, like a really good job of making sure that you clear the back, making sure you clear the abdomen, giving the client all the right exercises, balancing out the sacrum and the bones of the pelvis. And yet somehow their symptoms persist. They might get a little better. They might get like 50% better, but their symptoms somehow persist and they continue to come back. Well, why do they do that? It's because tissue holds memory, and the liver is particularly prone to this type of resentment that's held, this pushing down of emotions, right? Where are we pushing them into? We're pushing them down and down and down into the root of our being, into the pelvis. So this makes such a big impact. So liver qi deficiency with stagnation, we have to treat the emotional body as well. Some points here: gallbladder 34, liver 3, liver 13, which is going to treat both the liver and the spleen. So if you see that concomitantly together, liver 13 is your magic point. Liver 14 as well, I'd wrap that in there as well. Chapter gate and gate of hope, because you're also going to get the stomach. So you'll get the yin and the yang of earth with the yin of wood. Triple heater 6, pericardium 6, and then of course, if you've got that heat, add liver 2 in. The origin of the emotional imbalance or stress must be addressed in order to heal the dysfunction. Okay, so why do we need to do this? Why do we need to add pelvic care to our practices as acupuncturists? Okay, there are 32% of women and 16% of men that are experiencing pelvic pain or dysfunction right now, according to the Mayo Clinic. Now, there are statistics all over the place, all throughout the world, but these numbers are high. I've seen them go as high as 40% in women and up to 30% in men. The most common statistic is what I stuck with, so that's why it's there. That's a huge percentage of the population. That means despite that people are starting to talk about pelvic care and pelvic health, that there are still people out there that need help. And very likely, before I get into some more statistics, very likely some of these clients are already on your table. They may just not be talking about their pelvic health issues, but they're likely on your table. If they're on your table, they already have developed rapport with you and they trust you. Aren't you the perfect person to help them treat their pelvis? Like, yes, you're it. You're the one. According to emedicine.com, 1 in 7 women experience chronic pelvic pain, which lasts greater than 6 months. And I would say this number is probably even bigger than that as far as the duration of time. I have had women in my practice that have not talked about it for years. I recently saw an 82-year-old woman, and I've seen her for a long time. I see her whole family. I see both of her daughters, and I've seen her, and she's like, you know, I just want to bring this up. I don't know if you can help me, but I've had pelvic pain since like after the birth of my first kid. And the first kid is 50 something, right? 50 years of pain. That's a really, really long time to have chronic pelvic pain. What happens to your quality of life, right? To have pain for that long. Living with pain is not normal. So opening this conversation, that's our power as acupuncturists. Okay, these numbers are very likely similar in men. Pelvic pain is really poorly understood, and thus it is poorly managed in a traditional system. Many clients have associated health problems like sexual dysfunction, bowel and bladder dysfunction, fertility issues, orthopedic issues, systemic symptoms, and mental health symptoms related to what's happening with their pelvis. Outpatient physician visits for chronic pelvic pain totaled $881.5 million per year. And this is without everyone speaking up about what's happening with their pelvis. So this is a big, big population. There is a big need here. The first issue, again, is we have to start with awareness. There isn't enough awareness, and we have a unique opportunity to really change that culture. And I'm really excited for us to be able to do that. And facet number 2 is we have the potential to help these clients. Most of them, many of them are already on our tables. Okay, so there's a huge correlation between quality of life and the pelvic floor. So I'm just going to read one of these. You can read the rest of these as you choose. Pelvic floor disorders, such as in urine and fecal incontinence and pelvic organ prolapse, are stressful, annoying, chronic conditions that affect the life of millions of women of all ages in the world and lead to considerable impairments in quality of life. These 4 studies are just examples. There are tons and tons and tons of studies that indicate quality of life impact correlating with pelvic floor dysfunction. So we're just going to show here, there's a huge need. There is a huge need for you to bring pelvic care to your practice. Now, here's the good news. There are a lot of studies, not quite as many, but there are enough that are starting to verify that acupuncture combined with the rehabilitation is effective for chronic pelvic pain syndrome in females, which can significantly reduce pain intensity and improve pelvic dysfunction in patients. The combination of warm acupuncture and Kegel exercises has been found to be effective in enhancing pelvic floor muscle strength, restoring pelvic floor anatomy, and improving pelvic floor function among postpartum women. More and more studies like this are starting to pop up, which is great news for us because what we know is helpful is actually being researched and it's actually being demonstrated. We can make an impact for these clients, and that is huge. That's a huge honor that's bestowed upon us as acupuncturists. Okay, so 10 quick signs that your client needs pelvic care. 1, chronic pelvic pain. It's obvious, but very likely the client is not going to volunteer this information to you unless your website has in big letters, I treat pelvic health clients, right? So you have to be able to ask. You have to know which questions to ask your clients to see if something is going on with their pelvic floor, with their pelvis. Menstrual irregularities, fertility challenges, postpartum recovery, urinary or bowel frequency or incontinence, GI distress, menopausal symptoms, stress and anxiety, recurrent reproductive health issues, musculoskeletal pain in the pelvis, abdomen, hips, or low back. Okay? In these cases, when a client comes in with these complaints, it is worth starting to ask the questions to them about their pelvic floor, starting to be investigative to find out all the pieces that are surrounding their chief complaint. So go ahead and pop an emoji in the comments. Do your clients need pelvic care support from you? Give a thumbs up for a yes, definitely, or question mark for a not sure, maybe, probably. I'm going to keep going just because I know we've got a time limit here today. But here's how you can bring this into your practice. Here's the vision. 1, we've got quality of life impact. Okay. As acupuncturists, I know that you love, love, love helping clients, right? You're telling me in the comments right now that you love helping your clients and that they need your services, right? So that means that you have an opportunity to help them. You get to impact their quality of life. You get to teach them the skills to improve their quality of life, which is so amazing. This is the root of the body, and the root helps us to go directly to the source beyond the dysfunction that sits on the surface. This will also help you to diversify your clientele. You can utilize pelvic care to add wellness programs. So if you're super into Qigong or yoga or community acupuncture, whatever it might be, you can utilize pelvic care to bring in more clients through pelvic care specific programs. And you can do groups, which could be intentional or educational or energetic healing to get your name out there and help numbers of people. And finally, collaboration, collective, and community. Pelvic care opens you up to new resources, which can be a great source of referrals and collaborations. Walking the path together lightens the load. Just actually yesterday was Tuesday. Just yesterday, I got a mail referral from a chiropractor that's just down the road from me. We've been working together pretty regularly, and she's been sending me clients with pelvic care needs. And it's been so great because her practice is like across the parking lot. So clients can literally walk. So they get adjusted by her, and then their pelvis is like in the perfect position. They come to me, we needle their pelvis, their back, whatever it is. And then like it hones in on what's happening with the treatment and like is really solidifying what's happening. And I've had huge success. I got a text from the guy today, and he was able to achieve erection after seeing both of us yesterday. So, that's pretty awesome, right? To have these collaborations, collectives, and community. And it's awesome to not feel alone as a practitioner, because sometimes we get kind of like nose to the grindstone. We're with our clients, we're doing our thing, and we sort of feel alone. No one really understands what we're going through as practitioners, but community is key. And I love that about pelvic care. Okay, so you already have a lot of tools in your toolkit. You have the ability to provide a TCM diagnosis. You know general acupuncture. You know ashi points on the body. Maybe not yet with the pelvic floor, because there is, and I wouldn't recommend that because there is a lot of safety considerations to take into play needling the pelvic floor, but you know ashi points around the pelvic floor in those surrounding structures of the glutes, of the back, of the abdomen, right? Maybe you know spirit of the points or 5-element acupuncture. You might know electroacupuncture, moxa, gua sha, auricular acupuncture, herbs and supplements, Chinese nutrition, meditation, qigong, breathing, whatever your jam is. Those are already tools in your toolkit. Those are tools that will benefit your pelvic health clients. All we need to do is distill them into a methodology that really makes sense for these clients. So my treatment approach, okay, I do a full evaluation. I include the PFDI, which is, if you can Google it, it is a pelvic floor dysfunction disability index, which basically tells us exactly what's going on from a subjective approach, but it also gives us objective data because it's a survey that they fill out. We have the pulses, we have the tongue, we have TCM pattern. I do an ortho and structural assessment as well. On my first treatment, because I was trained as 5 elements, I clear possession, aggressive energy, and blocks. That's my jam. I find it to be very effective. You may or may not agree. That's up to you. After that, if the client has not had acupuncture before, I like to tend to get them in slowly. It's a little hard to go, right up to your client's pelvis. Oh, you can't see it. Right up to your client's pelvis and go with your needle, right? You're not going to do that. So you might start with auricular acupuncture if that's your jam. You might do some points that just kind of support the constitution. And then you'll probably start to bring in, because that's your foundation, right? We need to build a foundation. That's the big way that acupuncture works, is having a foundation. TCM pattern, spirit of the points, is next. So I sort of work with those depending, do I have a primarily pattern issue? Do I have a primarily spirit or emotional issue? Then starting to get within the structural work, bringing in those ashi points of the connecting areas. So that's the back, the abdomen, and the hips. And I'll keep going with the TCM and the spirit of the points. This is like session 5, and we haven't touched the pelvis yet, right? I'll keep going with then bringing in the pelvis to work with the anterior pelvis, the posterior pelvis. Then we'll go even deeper to specifically go into the pelvic floor. We'll keep progressing and analyzing our symptoms within what's happening in the body. But as we bring all of these into congruency together, we have a better chance of successful treatments for our clients. Okay, so here's my big tip, my big money item, as I said earlier, the pelvic breath. If you are seated on your chair right now, I want you to rock your pelvis back and forth. So as you rock back and forth with your pelvis, I want you to feel into where the tip of your tailbone is, and I want you to feel into where the pubic bone is. And now I want you to rock side to side. As you rock side to side, that is where you're going to feel those ischial tuberosities or sit bones. So what that means is we have a diamond between the pubic bone, the sit bones, and the coccyx, okay? So if you draw your attention to that diamond, on the inhale, you're going to imagine filling that area like a balloon. So you inhale and fill the pelvic floor like it is a balloon. This is relaxing the pelvic floor. On the exhale, we're going to squeeze that balloon. We're going to squeeze that diamond up and in. And you can feel contraction around the anus, contraction around the vagina, even the urethra. You can start to feel that contraction on the exhale. This is an easy exercise to teach your clients. So again, on the inhale, fill like a balloon. On the exhale, squeeze up and in. So why is this important? Well, it's important because often there is that proprioceptive confusion, which means when someone coughs or sneezes or jumps, they leak. Why? On the exhale, the pelvic floor is relaxing. We need to start to build awareness, which we're going to do through the pelvic breath. We also need to build some proprioceptive rewiring, which means that on the exhale, we've got a contraction so that all those organs are staying up and in, and so that the urine and the fecal matter are staying up and in, right? So pelvic floor is your gem. Some quick lifestyle recommendations, and then I'll pop over to questions. First off, give your clients the pelvic breath. Work with them. Have them put their hands on their abdomen while sitting on, a stool in your office. A hard stool is great because it actually allows them to really feel those bones. They can practice this gently relaxing the pelvic floor, gently lifting the pelvic floor. Again, the lift is done with exhale. The relaxation is done with inhale. You want to instruct your clients to avoid straining when they use the bathroom, whether that's urination or bowel movements, right? No power peeing. Power peeing is not good. Straining for bowel movements, not good. To help with that, drink half the body weight in ounces of water. So if someone weighs 120 pounds, they should be drinking 60 ounces of water. And they should avoid restricting water, even if leakage is an issue. Real quick story, on Friday last week, I had a client come in. She's been my client for a really long time, just had a hysterectomy. She's doing great. Everything is going well, except that she wakes up to pee. And she's waking up to pee at like 3 a.m, and her bladder is full. And I'm like, what are you doing with water? And she stops drinking water at 3 o'clock in the afternoon. So what's happening? Her body is holding on to the water because it knows it's not going to get any, right? That's not the answer. We cannot restrict water. She doesn't have a leakage issue, but still, you get the point, right? We cannot restrict water and expect our body to do well. It needs to have a continuous flow. It needs to be flowing. Water really likes to flow, right? That's the energy of the element. Have your client consider a squatty potty. Okay, if you don't know what a squatty potty is, look it up. They have a great, hilarious video of a unicorn pooping rainbows. Squatty potties are amazing. I literally have one in my clinic. You want to promote daily movement. So like Qigong or yoga or hot yoga or working out, whatever it might be that the client loves. A little bit of movement, not too much, a little bit of movement, that balance is always key in Chinese medicine, is really important. And I would also recommend limiting heavy lifting for clients until the pelvic floor symptoms start to improve. Avoid sitting in one position for longer than 20 minutes. That's another way to induce stagnation. Sit, don't move. Well, the chi doesn't move, and so thus the pelvic floor is stagnant. We don't want to do that. You might recommend a foam roller or a self-massager, or even utilizing one's own hands to massage the hips, to massage the glutes in the back, even to massage the pelvic floor. Providing nutritional recommendations based on their pattern, that might be something that is available for you in your practice. Providing herb and supplement recommendations based on pattern, that's going to be something that supports you as well. Also, having the client keep a journal or mentally monitor their symptoms in relation to their activities and their hormonal cycles, as well as their stress, is going to be helpful for what's happening in the pelvic floor. Finally, help a client to understand that working with the pelvis can bring up emotions, and really encourage them to lean into that emotional support. And if they're seeing you and you're working with the pelvis, you're probably a person that they trust, and that your space is a safe space for them. So just continue to encourage that. Okay, so here's my special webinar offer for you. My advanced certificate is $500 off for 24 hours. My Pelvic Care online bundle is $300 off. And my live practical, which is either in Portsmouth, New Hampshire, or in Hallandale, Florida this year, 2025, schedule will be published soon if those dates, times, etc., places don't work out for you, is $100 off. You'll get another coupon code like this week if you're not ready to make a decision yet. But this one, if you know you want to do it, it's good for 24 hours. This is the moment. Sign up, join me now, and I can't wait. So that's a wrap. Go ahead, throw some emojis in the comments about how you feel after the intro to pelvic care. Whether you're enamored with it like I am, whether you're confused, whether you're like, help me, whatever it is, just throw some emojis into the comments and then I will take your questions. Okay, let's see what we've got here. Ooh. Thank you for your comments. I love that. So far, no questions. Let's see, what was this? Informative and a wealth of information. Thank you so much. That's great. Hopefully I delivered on everything that you guys wanted to achieve in just a 1-hour pelvic care webinar workshop. Really excited, and I'm glad you had a good time. Okay, I'll give it 1 more minute, and then if there are no questions, yes, Kelsey, that is an amazing question. Okay, so in my live practical and in the online course certificate program, I teach about neural stimulation. So we do posterior tibial stim with a needle, as well as pudendal nerve. And sometimes I end up going in the practical over sciatic stimulation just because, or the sacral nerve root stimulation because that comes up. And yeah, so we do a lot with nerve stimulation. And I have found that in particularly male clients with urinary frequency, there we go, especially getting up at night, that the posterior tibial nerve stimulation is really, really effective. And I have found, and the research shows this for those that get the devices implanted, that if you do the same pattern of stimulation over and over and over again, the body does eventually accommodate to it. So what I do with them is I tend to use it somewhat sporadically. So I'm not going to use posterior tibial nerve stimulation every single session. I might alternate that with pudendal nerve stimulation or sacral nerve stimulation, or, spirit of the points, if that kind of thing comes up. But yes, I do teach that. I do like it. I do think it's valid. And I find it to be as, honestly, I find the results of someone coming in for a series of 10 sessions, like I said, that male, population client with frequency coming in for 10 sessions to be about as effective as the studies show that the implanted device is. But I do find the most progress with these clients is honestly, if we can start to get to the source of the problem. So there you go. Hopefully that answered your question, Kelsey. It was basically a yes or no question, and I just went down a soapbox, went onto a soapbox or a rabbit hole, whichever you like. Thank you, Dr. Shaybani. I really appreciate that. Any other questions? I'll give it 1 more minute. And then if you have to go, I just want to thank you so much for being here. I know that I am relatively new to the teaching circle for acupuncturists. So I really appreciate you kind of taking a chance and wanting to be here with me to learn about what I'm sharing and what I have to offer. I'm just really grateful. So thank you so much for being with me today. Okay. You're welcome. Okay, guys, you'll have an email in your inbox tomorrow from my assistant, Caitlin, with any other information that you have. And if you do have any questions, either about pelvic care for acupuncturists, whether it's bringing it into your practice, whether it is a specific question about how do I do this, or what does this look like, or how do you treat this? I'll do my best to answer those questions and field them. I love them. Oftentimes I do like an Instagram live on them, or I do a webinar, whatever it is that, kind of resonates at the time. But I do love fielding questions. And also, if you do have a question specifically about my program, please, forward those to us. And we're more than happy to help make things work for you so that you can bring pelvic care to your practice, because that is what I'm so passionate about. That ripple effect is key. Quality of life for all humanity is what we're all about here. So thank you, thank you, thank you. It's been my pleasure to be with you, and I'll see you soon.